There's no way we can talk about an effective Q4 strategy without CAHPS. So today we are diving deep into CAHPS, the survey that defines how members see you, how CMS measures you, and how your bottom line performs. Now, here's the truth most leaders don't want to hear. By the time the survey season rolls around, it's already too late. Members are not answering based on March. They are answering based on what they experienced in the months leading up. And that means Q4 is your leverage point. It is your chance to shape perception whilst they're still forming. So in this session, I'm going to give you the framework. We will talk about why Q4 is the most decisive period for CAHPS. And I'll also share three priorities that every leader should focus on, as well as 6 tactical plays you can run immediately and pitfalls you need to watch out for. Think of this as a masterclass in finishing up the year strong. Let's dive into it. Let's start with why Q4 is the most critical quarter. First is the recency effect. Behavioral science is very clear. People remember the most recent part of an experience more than the beginning. So if a member had a frustrating call in December, that is what will stick. If they had, a smooth appointment in November, that is what they will talk about. The second is seasonal stress. Think about your own life in Q4. You have the holidays, family, financial strain, deadlines. Members are no different. They are juggling refill appointments, New Year deductible. That stress magnifies every interaction they have with the helpline. So if you make things easier, you stand out. But if you make things harder, you sink. The third is momentum. The service tone you set in Q4 carries into the new year. Members don't mentally reset on January 1st. Their December frustrations or December wins bleed straight into how they answer the survey in March. So here's the key message. Q4 is not a win down period. It's your runaway. It's your last best chance to influence how members perceive you. Now, let's get into the 3 big priorities that would make or either break your Q4 strategy. Number 1 is proactive member engagement. Too many plans wait for members to reach out with problems, and that is being reactive. So instead, call them, text them, ask, how has your year been? Is there anything we can help you with before the year ends? I've seen many plan run simple year end campaign where, care managers just call to say, we are calling to check in to see how you are doing. Do you need help with meds? Do you need help with scheduling an appointment? That single touch boosted satisfaction more than any glossy brochure ever could. Number 2 is provider partnership. Remember this. Members trust their providers more than they trust their health plans. Providers are the gatekeepers. So if providers are neutral or they are silent about the plan, members will rate based on their frustrations. If providers actively reassure members, the score rises. So give providers talking points. And this could be simple ones. For example, your preventive visit is covered by your plan. Or if you have questions about your coverage, your plan can help. Even the front desk staff, the tone of a reminder call or the courtesy at check-in directly influences survey answers. Number 3 is operational responsiveness. And this one is often overlooked. Members forgive many things, but they don't forgive long hold times or unanswered questions or delayed authorizations. So you need to audit your basics. How long is the average call wait time? What is your first call resolution rate? How many days are your prior auths sitting in the queue? Small improvement here in Q4 can make a direct impact. You need to engage your members, equip providers, and then tighten operations. Those are your three strategic anchors in Q4 that can drive CAHPS performance. Now, let's go deeper. Let's talk about the 6 tactical plays you can run in Q4. Play 1 is the year-end member touch campaigns. And don't make this about closing gaps. Make it about service. A simple script could be, we are reaching out to thank you for being a member, and also we would like to check in to see if there's anything we can assist you with before the year end. It could be as simple as that. The key here is the follow-up. So if a member says, yes, I need help with scheduling colonoscopy, or scheduling my breast cancer screening, or scheduling a follow-up visit with my provider, don't just log it and let it sit in the system. You need to solve it, take action, and resolve it. Call them back and close the loop. Play 2 is provider incentive. Tie small year-end bonuses to satisfaction and recognize provider groups that are consistently getting high feedback, right? Getting high rates. Reward front desk staffs who deliver excellent service. When providers feel aligned with you, members will also feel supported. Now, play 3 is medication adherence support. Pharmacies are hidden satisfaction drivers. So partner with them to send automatic refill reminders, offer delivery options. A member who doesn't miss a dose in December is a member who answers positively in March. Your play 4 is your digital front door audit. Now, I want you to pretend you're a member for a second. Then log into your portal and try to find a provider or try to download an ID card or check your benefits. If this takes you more than 3 clicks, that is a problem. Every point of digital friction turns into CAHPS complaint. Play 5 is complaint to compliant conversion. Here's the fact. Members who experience service recovery often rate higher than members who never had a problem. So train your core reps to use empathy. They need to escalate quickly and also follow up. A denied claim resolved with compassion can turn an angry member into a promoter. Play 6 is care management visibility. High risk members are often the most vocal on surveys, so don't let them feel invisible. Have care managers call during the holidays. A simple script could be, we know this time of the year could be tough. We are here if you need us. That simple touch will create loyalty that no marketing campaign can buy. That is your 6 play tactical toolkit for Q4. None of this works without clean data. Start with contact accuracy. If numbers and addresses are outdated, your outreach will definitely fail. Next, also segment dissatisfied members. These are members who filed grievances, who is at risk of leaving your plan, or who called multiple times. These are your high priority targets for service recovery. And finally, in real time, don't wait for CAHPS survey to tell where you are failing. Watch call sentiment, grievances, or appeals categories, disenrollment drivers, and use that intelligence weekly to adjust your playbook or your strategy. As a leader, your role is to set the tone. Okay, so remind your teams every call is a survey answer, every claim is a survey answer, every refill is a survey answer. Frame CAHPS not as chasing stars, but as building trust, because members don't care about stars. They care about whether they felt cared for. When your team internalizes that, the score will automatically take care of themselves. Now, let me highlight some pitfalls. Number 1 is relying on generic mailers. Members do not read them. Human touch will always win. Number 2 is focusing on clinical metrics. CAHPS isn't about cholesterol, blood pressure, or A1C. It's about access, communication, and courtesy. Number three is waiting until March. A last minute blitz looks scripted and desperate. Start now and build consistency. Now, let's bring this home. Q4 is your leverage point, it's your chance to engage members before they need you, to empower providers as your ambassadors, and to also tighten operations so friction disappear. Do this and you don't just boost CAHPS scores. You build loyalty, you retain members, you strengthen your plan's foundation for the future. Remember, CAHPS isn't about survey, it's about trust. And trust is built or lost in moments. So finish the year strong, serve very well, the result will follow.